Hello again, this is Dr. Christopher Trinh at Miracle Dental. Today we're going to talk about partial denture. What is partial denture? Partial denture. Partial denture is like for patients that come in with some remaining teeth, but they have some missing teeth long ago, or they about to lose some teeth. So to show you an example, so this is an example of someone that have some missing teeth and some remaining teeth. Now, assuming the remaining teeth are solid, right? Then we can make a partial. There's different type of partial. There's one that made out of partly metal, and which is like this one. Okay. So as you can see, they have a metal frame. You have some hooks, right? And they have like a major connectors here. So this is something that you can replace teeth on both sides. Kind of like, this is not exactly for this, but it's like this, okay? Now, there's another type it's made out of valplast, okay? It flexes, right? So it's like this, right? It flexes, right? So, and it's snap on like this, right? Right? It's light, it's flexible. As you chew, it flexes. So those are the two different type of partial denture that you can have. One's with the metal and one with the valve. This is what you call like a flex or a valplast material. So what's the difference, right? You might ask, or what's better? What costs more? How long does it last? Which one lasts? But which one's more comfortable? These are the very common question that we get. So let's talk about the valplast, right? So to me, the advantage is a lot lighter. It's more aesthetic. You have no metal. So for patients who have like allergy to metal, like highly allergic to different type of metal, this works really well. Okay, and it flexes, right? Now, some people might like the flexing part. Some people might not. Okay, that's the answer I get from some patient. But most of the time, a patient can have it, they're like this, right? Naturally, right? Because it's look a lot more pleasant, right? So that is the advantage of this. The disadvantage of this is like, let's say you hook onto the teeth here, right? If you look here, right, it hook onto this too, right? There's a hook, it hooks on here. But now let's say, God forbid, the anchor two, right, that the partial hook on, let's say you lose that. We cannot add a two to this, right? Once you lose a two, any of the remaining teeth, right, and you need to add the partial, you cannot add to this. You have to make a whole new partial. So that's to me like a major disadvantage. But like if you take good care of your teeth, right? You should have the remaining teeth for a while. So now let's talk about the metal framework partial, right? This is a metal frame partial, right? So these are the hooks. So these hooks are usually hooked onto the anchor teeth, right? So like since this has a hook here, so there's usually a tooth right here that it hooks on, a tooth right here that hooks on, a tooth right here that hooks on, right? The process of making a partial is very similar to making the denture, right? We still have to take impression or scan, pull up a model, and then we make a occlusal rim, the wax rim, and that's mimic the bite, right? We have to measure the bite, make sure the bite is correct, the patient closing, chewing in the most comfortable position, right? And then after that, we mount the case on an articulator, we set the teeth, then we take, imagine, this is a final product, but imagine the teeth here in wax, we take it, we put it in the patient's mouth, we make sure everything fit, we make sure the bite is good, patient's comfortable. Once that's all done, patients say, yeah, everything feels good. We take this, imagine this acrylic part is in wax, okay? We send it to the lab will process it to the final product. Then we take this as a final product and we give it to the patient or we deliver to the patient. Okay, so the process of making the partial denture is similar, right? It's just one is a complete denture and the other one is a partial with the metal framework, right? So what is the advantage of this versus the Valplast or the Flex partial? Like I said earlier, some people, this is more sturdy. It doesn't break easily. The other one doesn't really break easily. But this one doesn't really flex like the other one. Some people just don't like the flex, but I find it very rare. Okay. But this one, if you anticipate some potential teeth loss in the future, let's say a patient had periodontal disease, gum and bone disease, like you'll expect, but they don't want to part with their teeth at this time. They know that they're going to lose some teeth down the line. So what we do is we design the partial, should they lose the teeth down the line, that we potentially can add onto the existing partial. That is possible, okay? Where the Valplast is no way, okay? We cannot do that. So this is the big advantage over the other one. The disadvantage that you can see, metal. When you're allergic to metal, forget this, right? Aesthetically, it's not as pleasant as the other one. So it's just kind of like different show for different folk, right? But over time, I see more and more people are transitioning to the Valplast versus this, okay? But that's the difference between the type of partial denture that we make here at our office. But just keep in mind, everybody's different. We will, customize the treatment and depends on the patient need and the patient wants. Okay, but these, are the two different type of partial ones. Here's another type of Valplast, just so you can see, right? Yeah. So as you can see, one's metal, one's is Valplast. Okay, so these are the different type. Okay, so with the Valplast partial, as you can see, the teeth that is going to be hooked on is this one, and this one. So with the Valplast, usually, since it just kind of the advantage is it's just snap on, right? It hooks around the tooth, right? It hooks around the tooth, not on top of the tooth. So therefore, I don't have to carve anything on the teeth itself. I don't have to create like a little divot, indentation for the partial to hook on, because it wraps around the tooth like this, right? It wraps around the tooth. So nothing go on top. So I don't have to carve space or anything. It just wrap around. So that's another advantage about the Valplast. Okay. Now, with the metal partial, I don't know you can see this, we call it rest, okay? So this go on top of the tooth, right? It doesn't go around. Yeah, you have the hooks here that goes around, but if you can see like little, like a half moon shape right here, right? See this right here on top here, right here, and this right here, right? That. So, and then this little circle here, little circle there, that circle here. So these things go on top of the tooth, like so, right? It goes like on top of the tooth like that, right? So because you have this circle, right? You have to make space for this to sit on, right? It cannot just sit on top of the tooth, because then it's going to be, let's say your tooth is like this and you have something sit on top. Now you just increase the patient's bite, right? That's not going to work, right? So you kind of have to carve on top of the tooth to create space for that we call rest. So what we call is we have to create red seat on the tooth. So basically we just carve a small portion of the tooth, right? Very small, like, 1 millimeter, sometimes 2, depends on where, for the reds of the partial to sit on top, right? So that way when it sit on top of the teeth, right, you don't increase the patient bite, right? Because imagine the upper arch and the lower arch, the teeth come like this, and you add something in between, it's going to go like this. So you can't do that, right? So what happened when you do that is the patient jaw, the joint, it might get sore because that's not the normal position, right? So we have to kind of dig into the tooth a little bit, like create a little bit of a space, like carve it out. And then so then now that red seed on the partials will sit flush on the tooth. So when the opposing two come together, it's stay on the same plane. It's not open up, okay? So that is one disadvantage with the metal partial. Let's say patient come in, they lost some teeth. It's okay if they have natural teeth, and no problem. We just carve it on the natural teeth, like a little space, right? We carve a little bit of a tooth out. So this we can make them a partial like that with the red seed on it. Now imagine if patient comes in, have crowns on the teeth that we need to use as an anchor for the partial. The problem with that is, let's say we carve on the crown, on the chewing surface of the crown. We don't know how thick that is, so potentially that crown can fracture off. So most of the time, what we have to do, like, okay, ma'am, sir, we might have to, probably going to have to make you a new crown so that we can incorporate that red seed inside the crown. So when we make the partial, it can, sit on top of it flush, right? So that's another disadvantage with the metal partial. Some patients, okay, they go, okay, I'll just make a new crown, but not everybody want to make a new crown, if they just had it done. Now, keep in mind, most insurance, they allow replacement every 5 years, right? And you have to show something wrong with the crown before we can just replace it. So that's another disadvantage versus the Valplast. That's some additional information that I want to share with you about the difference between metal framework partial and the Valplast partial. Feel free to reach out if you have any further questions. Our number is 702-456-0056. Have a great day.